We are to discuss motherhood, right?
Yes.
Yes, we are here to discuss motherhood. All things motherhood.
Yeah.
Prenatal, antenatal, intrapartum. I need to mention that I do have mental health spiciness.
I love it.
Spiciness. Okay?
A bit here, a bit
So
there.
let's stop this story of pregnancy, baby, because it's
Yeah.
already stressing me out. I don't want to miss. So she kept probing. You need to test. I think I got a break from work for like a week. You need to go and see your doctor before we can continue. When I tell you, I went to my car and wept. I wept because I know what this means.
Yeah.
I cried so much. My God. My baby was not moving. I think second day when I was in hospital wasn't moving so much. And I remember we had to go and have a scan done at like 2-3. Follow your guts. Listen to your guts. To be very honest with you, there's a sixth sense. It cannot be explained by anybody or anything. Follow your sixth sense in anything and everything.
Welcome to A Dose of Health, the podcast. This is part 2 of a conversation we had with Lynn. My name is Dr. Hope. We have Lynn as a guest today, and she's taking us through her journey to motherhood. And we just want to continue from where we left off. Akuna story mingi now. Yeah. So now, please, we had stopped at, the baby has come out. The cord was around the neck 4 times.
Yeah.
The floor is yours.
So after that, of course, very nervous. I remember thinking, I need to see my baby because I couldn't even remember the face visually. I want to see my baby.
Yeah.
6 hours after that, yes, let me tell you something. I stood. I was like, I'm going to walk. And I walked to the nursery.
Wow.
I was like, because I had initially asked, please just bring the baby to me. Bring the baby to me. Oh, it's cold. You can see the baby later. I was not okay with that. That is something I was not okay with.
Yeah.
Let me just see the baby. It will give me peace of mind because already so much has been happening in my pregnancy and particularly my 3rd trimester. I just need to see this baby is okay. So eventually walked to the nursery.
I'm sure they were like...
because it was like 3 a.m. in the morning. And when we got to the nursery, the nurse is like, ni wewe umetoka CS size? I'm like, yes, I want to see the baby. I need to see my baby.
Yeah.
I also, after that, of course, so the baby went back to sleep. Next morning, I'm like, I want the baby here, constantly. Mostly because I was worried should I ever get another child, if ever, I'll agree
Never
for
say
help.
never.
I'll agree to the help because at that time also I was anxious and I was like, I don't want it to be that I have over-relied on the nurses to take care of the baby. That when I go home, I'm stuck. So I insisted to have the baby. When I tell you second night syndrome.
Wait, what's that?
Actually, they call it second day syndrome, but me, I know it as second night syndrome, where the baby cries throughout. You put them to their breast. Mind you, that time I don't have milk. You're so... Yani, you put them to the breast, they calm down a bit. They've calmed down. They seem to be asleep. You put them aside. You try to sleep, crying and crying. I didn't know about that. I swear to God, I did not know anything like that existed. And had I known, first, you just need to put your baby to your chest. Like, accept this is happening.
That they're
acceptance crying. Actually, let me tell you, acceptance has helped me a lot in this motherhood journey. But putting them to your chest, that time they don't really move a lot. Even if your bed is reclined and you put them to your chest, maybe you have like a breastfeeding pillow around you to just support your arms and support the baby. You just put them there. They calm down. They actually calm down and you can actually have a break. Or you can have someone stay with you to hold the baby. Because they constantly would want some warmth. They want your presence. And also, they've been in this place for this many months, actually 10 months.
Yeah.
And then suddenly it's a new place, noise, lights.
Yeah.
The country. I think it's a bright environment. It's noisy. It's not different. It's different. It smells different. It feels different. They get anxious and they start crying. It was, oh my God.
There goes your sleep.
Where? I remember calling my mom and saying, you need to come to hospital now. I didn't want anybody else.
Yeah.
I wanted my mother because at that time, you're like, this is when I'm appreciating. Oh, this is okay.
This is
Kulea ni
motherhood.
hivi. Okay. Ni hivi. Tunaanza hivi.
And on day
A
2.
steep curve. Learning curve is day 2. Kidogo. Fine, my mom comes. He's able to talk to me. I cried that day. The second day, I cried, I think, from morning to evening. Because I'm like, what did I get myself into? What is this? What did I get myself into? To a point where the nurses told Dr. Rain and Dr. Kenya, your patient is depressed. She needs to talk to someone. The patient is depressed. Needs to talk to someone. But I'm like, no, I'm not depressed. I'm anxious, which true at the time. I actually was anxious. I was more anxious than anything. Day 3 comes. Day 2, actually, I remember noticing a tinge of jaundice. I mentioned I deal with kids a lot. So examining is, of course, I examined the child. So I remember taking the child to the light and I'm like, am I seeing?
What is this?
I'm like, no, it's not. Day 3 comes. The pediatrician comes. Dr. Rain wasn't available at the time, so sent a colleague. Comes. They have these probe thingies at Nairobi Hospital where they just put at the ear and they're able to measure bilirubin levels. And you know how we communicate when something is off?
Yeah.
The
silence.
The
silence
silence.
for their cues.
The silence and then the repeating.
Yeah.
Repeating. I'm like, something is wrong.
Yeah.
The levels were too high. Initially were unrecordable. Then second time around, they were almost 290 something. I don't know. They were very high. 291 or something. Very high. So what does that mean? My baby needs to be admitted for phototherapy. When?
One thing after the
other. And let me be honest. I know this will sound ridiculous. Please don't judge me. But even when I used to date, I used to ask guys, what's your blood group?
It is important.
And not because of rhesus or anything, it was because of ABO incompatibility.
Yeah.
So for me, it was, we're incompatible even from blood.
You've already locked him out.
Oh my God. So Sasa, for sure, my husband and I, we don't have the same blood group. So I knew, as in we already knew, after when Dr. Rain eventually came, we were like, this is ABO incompatibility. Like, it is what it is. We know what it is. And of course, now readmission of the baby as now a patient. Phototherapy. Mind you, I still don't have milk. I'm stressed. And people, let me tell you, breastfeeding is such a mental thing. If you're not okay here, oh my God. And it didn't help that sometimes I'd go to the nursery and you'd hear the nurses, your number so and so, liquid gold. Oneni, liquid gold. Bruv.
And you're just there like,
after 10 ml sijatoa. As in, heartbreak. Apana. It was a lot. Constantly, no, you need to pump. Mtu anakuja, the other thing, kufinywa matiti, kufinywa. Bruv, if there's nothing coming out,
I remember.
It's not coming out.
My sister went to visit her friend who just had a baby. And the nurse came in now to examine and just see if everything is okay. So her friend was telling her, I don't think I have enough milk, or the baby is not breastfeeding, the baby is a bit fussy. So the nurse is there trying to check, let's see if you have, milk, and doing all the finya. And my sister was so shocked.
Yes.
So just like, you're not going to tell us to come out. Like, sometimes it's just like the dignity.
Yeah, the dignity. But let me tell you something, Hope. And you will hear a lot of women say, dignity unachianga mlango ya labor ward. Hapo. And I think at that time you don't even think about that your breast is out here, because especially if you had a vaginal birth and your legs were all up or you were squatting, you don't care.
You're like, so like,
you are so, I think also you're normally so out of it.
Yeah, you did.
You don't even realize until in hindsight you're like, oh wait. I said that because there's a time I opened the door to a delivery guy and my zip was open and of course, I had my breastfeeding bra at that time.
Yeah.
And I think this nini, the clippy
Yes,
thing,
yeah.
it was ilikuwa hata chini. He could not see my full breast, but he could see part of it. And I swear, up until like an hour or so after he had left is when I was like, wait, I opened the door like this. So by the time, even when there are people in the room, and of course, initially you may feel some form of embarrassment. Ideally, they should have removed people, of course, to examine. For me, it was the pressing. It's not, hapana.
Like, hakuna.
It's hakuna maziwa, like iwache. Actually, by the way, iwache. See by force. Yeah, eventually we ended up getting discharged, but I think for me, I was not okay. And it's good that the nurses had picked it up. I was just, again, denial, but I think at the time I was more anxious than I was depressed. Because when we got home, any things was just happening. My husband got sick. So now ni mimi na mtoto tuko peke yetu hivi. He got sick. And if you're sick, I'll not allow you to touch. I will not allow you even within 2 feet of this child. You wear a mask throughout. Anywhere I would see him touching, I would go with a sanitizer. Like I'm spraying light switches, door handles, everything. Umeshika hii part ya meza. And I don't know if after giving birth there was an element of OCD that came out in me, because especially even now, I hear you coughing. I will observe everywhere you've touched. Everywhere. And I will go, once you leave, say you're in my space, once you leave, I'll go sanitizing the whole place, like mahali ulishika. And I will mark everything that you touched. Everything. Yeah. Like, yeah. It's insane. So
okay,
of course
that's
that
a bit
happened.
much, but I get it.
Yeah, but it happened and he got sick, and my parents at least were able to come and take care of us for like 3 weeks. Yeah, we were able to go home for like a couple of weeks where he recuperated. I was able to be with the baby, and even then, even at home, I was still so anxious. You can imagine my mom trying to hold the baby to help me, and I'm like, unamshika vibaya, bruv.
Like, I've mothered 3 of you. You're 3 girls, right? Yeah, I've mothered 3 of you.
It doesn't help. My baby had reflux. Then there's something called dyschezia that I didn't know about. So, but the dyschezia came much later. But gassy, he was also very, very gassy. When I tell you my baby alikuwa make it, like I'd be with my baby here, and maybe you're sat there, you could hear his tummy rumbling.
Bobby rig me.
So we're not sleeping because he's constantly grunting, fussing. I try maneuvers. These maneuvers that we tell parents, oh, find 2 bicycles. How about I tell you the things I have learned?
From the depths of the internet?
Yeah, I don't even do bicycles. There are actually other maneuvers I use.
Yeah.
You don't know how to burp. Burping is another thing. Oh my gosh, because you're trying to release as much gas as possible. So that was a horrible time. So coupled with the anxiety, coupled with all these things that are happening, so my husband is sick, I have a gassy baby, a refluxy baby, we have had this traumatic birth. Things just started going downhill. And how I can best describe it is being in a room. All the curtains are blackout curtains. They're shut. You can see there's light at the very edge, but you're trying to go there, but there's something, ni kama umefungwa kwa kiti hivi. You're trying to go, but you feel, I have so much weight, I can't even stand to go and open the curtain. Because you can see there's light. So there's a light at the end of that tunnel, but I can't reach. There's no switch around me, so I am just in darkness. So I knew it had gotten bad because after we went back home, now back to our house, milk supply dipped so suddenly. Because initially I was really, I really had a lot of milk. Because also another thing I didn't know, cluster feeding. My baby would be on the boob from midnight to 3 a.m. non-stop.
What do you mean non-stop?
Non-stop. anaenda kulala kidogo ati I go to remove, because at that time to nini supply, to increase supply, they tend to cluster feed, which it's such a tiring thing.
I can imagine.
So constantly on the boob, and I try to remove, he cries. Back on the boob, seems to be sleeping, I remove, he starts suckling, and it's suckling like for real we're suckling. So of course I'm not sleeping. We have a gassy baby, so I'm not eating very well, because constantly I keep blaming myself and telling myself, nikikula hii ndio na notice gas imekuwa more, nikikula hii, nikifanya hivi. So I was on rice, meat and cocoa. That's all I was taking.
Where's the vegetable?
I couldn't even take greens because the assumption that I'll get, like, mtoto atakuwa very gas. Like, there were things I'd been told, maybe try cut out this, try cut out this, try cut out this, because we legitimately had a gassy baby. Of course, it's their gut that has not developed. So, but honestly, something's tended to worsen. Like, if I ate chapati, that would tend to worsen. I can't explain, but it did. So I would stop. So when I eat rice, nyama, and cocoa, those three things.
This cocoa seems to be standard amongst especially breastfeeding moms.
Yeah, because you are told it's a galactagogue. Is it? Not really. But no, for real, when you research and read on Lily, you're better. It's hydration. It's the hydration aspect of it, not necessarily because it will promote, and maybe because also it will relax you a bit. So you're relaxed, and therefore you're able to produce milk. So eventually went back home. Things are not okay. Like, I'm not okay. I'm still very anxious, feeling the way I'm feeling. I would wake up sometimes, natafuta mtoto. The baby is at the cot, on the cot right next to me. They're not even in bed with me. But I'd be dreaming that nimemlalia. And I'd wake up scrambling sometimes my bedding, or I'd wake up and look under the bed, and my husband would be like, ni nini mbaya? And I'm like, mtoto ako chini ya kitanda, mtoto ako wapi? He's like, no, mtoto ako hapo. The day I peed the bed was the day I said, Dr. Vundi?
Hi, please.
Dr. Vundi? Things are not okay here.
Yeah.
Things are not okay. Sorry, when I talk about this, I actually get very teary because it was such a bad time. Oh my God, it was a bad time. Anyway.
Sorry. Where are my tissues? Where are my tissues?
So eventually, of course, she came to my house.
Oh my goodness. Can I give you a wipe?
Please. Will it work? I don't know. It's fine. I'll actually use my hands. It's fine.
Okay, can you get some tissue from the bathroom?
It's fine, but
so sorry.
Eventually, she came to my house.
Oh.
We had a long conversation, a very long conversation, and I was able, of course, to, just as I told you, my birth, pre-birth, give that whole history on, of course, my mental health history, and of course, pregnancy history. And she was able to explain it so well to me, how, of course, hormonal changes.
Yeah.
And even when I used to have my period, even when I didn't have my period, what would happen? I would, for 2 weeks every month, I would have really bad mood swings. So PMDD kind of symptoms, like seriously depressive kind of symptoms. I would have low energy. I would be crying. Yani, it was explained everything. Oh, hormonal. In addition to that, I told you, mental health spiciness. Some spicy medication.
Just a bit here and there.
So other medication I had been stopped. And you see what happens with, I've not mentioned this, but I just may have to mention so that there's a bit more context, is I do have ADHD.
Okay.
So this is something, it's so funny because Drops of Caramel, I can't say her name, but Drops. The very first time we started interacting, she was like, you need to be evaluated. You need to be evaluated for ADHD. You know, here.
Yeah.
But see, now the thing is, when I did get evaluated, like there's a whole questionnaire.
Yeah.
There's a whole
The
tool.
criteria.
There's a whole, and for sure, my primary issue actually is usually ADHD. And because I had not been on the medication I normally am on, I need to explain that with ADHD, your mind is always running.
Wanderer.
And you always, you struggle with executive functioning. So planning, coordinating, consistency, you struggle with a lot of that. So having a baby is such a big shift. You struggle with that. Because it's a big task. You first of all, prioritization normally is a problem with ADHD. Knowing how to maneuver big tasks. So you tend to procrastinate a lot. Can I procrastinate bringing up a child?
Unfortunately, no.
Yeah. And when something, and especially when things tend to become repetitive, because it would be waking up, breastfeed, burp baby, baby poops, change, repeat.
It's a loop.
It's a loop. Your mind goes crazy. So I struggled with that. So of course, put back on that. Put on an anti-anxiety. It works as an anti-anxiety, antidepressant. And after that, of course, initially when I started the medication, not gonna lie, I was very anxious. The medication.
Were you still breastfeeding?
No, at that time she advised me on not breastfeeding because I was not. First of all, that maziwa ilikuwa imepungua. So there's no point. Yeah, so there's no point in stressing yourself already more. And what was necessary was that my baby needed a mother who is functioning. Need a mother who is healthy, a mother who is functioning, so that they can enjoy being a child. They can grow up the way you want them to grow up. So that after that, and I think after we hit 3 months and I'd been consistently on medication, not gonna lie, I got better. It's not fully 100% because there are times you're like, ghetto.
Yeah.
But I got better. I got to learn how to maneuver things. I got to embrace myself as a new person.
I love it.
Yeah. And the one thing that I kept telling you that saved me from motherhood, it saved me during motherhood, during this period, has been radical acceptance. Radical acceptance
it is what it is.
So hard.
Yeah.
Because the day I accepted that it is what it is, this is what is happening to me right now, I was able to cope. Yeah.
Okay. I love that for you.
Yeah.
Those were not wasted tears.
Yeah, thank you.
Yeah.
They were not. Niko sawa sasa.
They were no. Tuko sawa sasa.
Niko sawa sasa.
Nisikia a certain type of way.
Niko sawa sasa.
But I'm so I feel like when I saw you coming back onto social media,
not
that that's a sign that someone is okay. I was just like, I like that because I felt like you were getting a place to vent.
Yeah, I actually was.
You come here just like,
actually
you
was.
guys, can you sing this hair?
Yeah.
I had hair yesterday.
I had hair yesterday. The next thing, half of it is on the sink and I'm like, what?
Yeah.
It's there. Yeah.
I love that for you.
Yeah.
So where would you say you are now? Because I know the postpartum journey it's quite long. Like normally we say 6 months, but it can extend.
Yeah.
So how are you today with an 8-month-old, having gone back to work?
I'm much better.
Yeah.
Where I'm at right now, I am much better. Okay. I am more bold. I am unapologetic. Let me tell you, I don't know, something changed. I'm very unapologetic about my thoughts and my opinions. I will tell you as it is.
Yeah.
And I will not make any apologies for it.
Okay.
I think I am very, very biased towards women, Sasa. Not that I was not before. Now it's down. It's times 20.
Yeah.
I see a woman, and especially a pregnant woman. Oh my God.
Yeah.
Oh my God. I give you so much grace because I don't know what you're going through. I don't know your situation, not only physically, but even your social situation. I don't know what's happening. Also, postpartum mothers, a lot of grace.
Yeah.
And now my approach, even in seeing patients, is very different from how it was before. Because now I am able to put myself in the shoes of that woman who is stressed out about their baby, who is sick. Yeah. And no matter how small they may think an issue is, I'm like, no, don't minimize your worries. You're a mother. I'm able to embrace that. Honestly, that has been a game changer for me, because even interacting with patients, I don't see anything as a small issue. Again, I stopped seeing that. Like, it's a non-issue. No. I have been at the point where things that would have been non-issues to others were issues to me. And I'm glad that the people I turned to did not minimize my issues. So same way. I'm not going to minimize your issues.
Okay.
Yeah.
Wow, I love that. And I really wanted us to reach here.
Yeah.
And this conversation was mostly just to show that mental health is so important, first of all.
Yeah.
And motherhood on its own is a journey.
Yeah.
It doesn't just start when the baby comes.
Yeah.
It starts from way before.
Yeah.
And we need to hold the hands of these young ladies who are going through this journey.
Actually,
and support.
Another thing I'll say is, Aki, if your friend is pregnant
Yeah.
and they're not reaching out to you and they're not talking to you, give them grace.
Okay.
Just give them grace. They're probably going through a lot in their minds. Shoot a text here and there. If they respond, good. If they don't take it personally. But the shit is just happening. And especially Kwanzaa, fine, during pregnancy. But even after, oh my God, give them grace.
Okay.
Just give them grace. It's not, don't take it personally. There's just so much that's happening. Support like you can. And sometimes support can come as, if you know where they live, show up. Show up after, of course, saying, I know you're going through this. Maybe I've brought you food. Iko hapo nje. You don't have to open for me. Don't expect to be a visitor. When you're coming to see someone with a baby, don't come to hold the baby. Holding the baby is the least of their concerns sometimes. If there are dishes that need to be, because si kila mtu can afford nannies and anything. If there are dishes that need to be cleaned, clean those dishes. If there's clutter, there's dirt, wash the house for them, clean the house for them, or get someone to do that for them. Hold for them the baby if they are okay with that, because sometimes, especially first-time moms, we're very anxious and we're not very willing. Mtu asikudanganye, we're not normally very willing to let go of the baby. Ati shikilia mtoto. No, because I'm looking at how you're holding the baby. Is the baby comfortable? Have you worn strong perfumes? That's the other thing. Why would you wear something strong when you're coming to see a baby? Strong perfumes. No, be very clean. Also, ideally, it would be nice, have a change of clothes when you're going to see them, so that whenever you change your clothes, you don't bring your outside clothes to come and hold them, especially very small babies. As they grow, wako exposed. But very small babies, ideally, just be sure that you care in other ways. If they don't respond to your text, or they respond at 3 a.m., take 3-4 days to respond. Don't take it personally. But it's so much is happening at that time. So yeah. Give your friends grace and show up for your friends. Or even better yet, there's a friend of mine called Wangari. Hi, Wangari. She asked me when I was pregnant, how would I feel someone is showing up for me in postpartum? So maybe you can ask your friend, how do you feel I can show up for you? What would you want me to do? And even if you don't, it's fine. Take your time, or you can suggest some things. But
wow. Asante sana. I know we can go on because we are serial yappas.
Yappa-itis.
But I think I've learned so much. And for me, it's always been standard. I have to ask, how would you like me to show up? Or what does support look like for you? And then we can see how to come in. But that whole journey of postpartum, especially the first few weeks. First 8 weeks. It's normally eye-opening for me to hear someone's story and to just hear like how difficult it can be. So thank you for sharing.
You're welcome.
And hopefully this will resonate with a few moms out there, even people who are still looking to journey into being a mom. And hopefully we can get to have more of this conversation so that it's not taboo to talk about. It's not coming from a place of shame. So asante sana. So many take-homes.
Thank you.
You can plug yourself. Where can we find you?
My FSMD on Instagram, YouTube. I'm not very active right now. Niliwambia mambo ni mengi. Wakati masani machache. Mambo ni mengi saizi. First of all, I have a teething baby right. Oh, Jesus Christ. Milestones. Sleep regressions. My God.
Ziko
Grace.
mingi.
Mambo ni mengi. So I am on Instagram. Have I been active? Not so much, but I am going to start being active.
Thank you.
Yes.
Thank you. You'll be a very good voice for young mothers.
Thank you.
I mean, I think people really
Yeah.
resonate with seeing what
Yeah.
other people are going through,
Yeah.
so that you don't feel like, kumbi, I'm not alone, you
Yeah.
know.
Yeah.
Okay.
Yeah.
My name is Dr. Hope. You can follow me on, should I say Dr. Hope with Simiyu with many hyphens, but mostly on A Dose of Health, our socials, Instagram, TikTok, YouTube, Spotify, Apple Podcast, anywhere else you can find us. Tufuate tu hapo. And that's a wrap.
Yes.